Is the leading cause of cancer deaths in the United States. It's important to understand that lung cancer can be treated successfully when it's found early. Here with all the details is the medical director of the Middlesex Health Total Lung Care Center, Dr. Justin Gorelnik. Nice to have you here.
Thanks for having me.
So first, let's talk about the symptoms of lung cancer. This is kind of scary.
Sure. So oftentimes the symptoms can be something as simple as a cough. They can sometimes feel fatigued. They can have shortness of breath, chest pain. Oftentimes they may actually cough up blood at some point. The scary thing is that when these symptoms become prevalent, it's oftentimes a little bit later in the course.
And you recommend screenings. Who should have these screenings done?
So people who should be screened are people that we deem high risk for developing lung cancer. So these are patients between the ages of 55 and 80 who have at least a 30-pack year smoking history and who are asymptomatic. And they have to have at least smoked within the last 15 years.
Okay, and then once you have these screenings, if you find something, there's usually a success rate.
Correct. So the purpose and the mission of the lung cancer screening program is to detect cancer in its earliest stage, which opens up a wide range of therapeutic options, including surgery, which is often with the intent to cure the lung cancer.
And at Middlesex, you really specialize in this. You have a whole lung care center.
Correct. So we developed the high-risk lung nodule program, whereby patients who are found to have incidental nodules or lung masses, whether it's through screening programs or just incidentally found in the hospital, we set them up to come into the high-risk lung nodule clinic to see me, and that's where we kind of begin the process of diagnosing, treating, and offering supportive services for those people.
And one of those supported services is a nurse navigator, which I feel like would be really helpful for a family or a patient going through this.
Absolutely. So they are able to reach them at any point in time to offer any support while they're going through their diagnosis, while they're going through their treatment, whether that be chemotherapy, radiation, or hopefully surgery in the case of,
clearing it up, right? What does it mean for Middlesex Health to be designated as a lung cancer screening center of excellence? This is a big deal.
Right. I think what it means is that patients should, and the whole purpose of this is to really spread awareness. I think there's a lot of people out in the community who aren't even aware of lung screening programs that are available to them. We know that there's thousands of people who continue to smoke and are at high risk for lung cancer and have never had a screening scan done. So all of this is really to just raise awareness, and by being a center for screening for excellence, we're able to provide timely diagnosis and all of the care that they would need moving forward once their cancer has been diagnosed.
So it's so important to get these screenings.
Very important.
Could save your life.
Could save your life, literally.
There you go. All right, and for more information, you can visit middlesexhealth.org. Doctor, thank you so much for being here.
Thank you.
Sure.